Smoking is not just a habit. It is a slow decision that affects your body every single day, even when you don't feel it. Many people smoke to relax. Some smoke because of stress. Others smoke because they started young and never stopped. But what smoking really does inside your body is very different from what most people imagine. This video is not to judge anyone. It is to explain the truth clearly and honestly. A cigarette is not just tobacco. Every cigarette contains thousands of chemicals. Many of them are toxic. Some are directly linked to cancer. When you inhale smoke, it doesn't only go to your lungs. It enters your blood. Then it travels to every part of your body, your brain, heart, liver, and even your skin. Smoking affects you even if you smoke only once a day. Damage does not need permission to begin. Within seconds of smoking, nicotine reaches your brain. Your brain releases dopamine, the feel-good chemical. This is why smoking feels relaxing at first. But at the same time, your heart rate increases. Your blood pressure rises. Your blood vessels tighten. Your body enters stress mode, not relaxation, even though it feels calm. This is how smoking quietly tricks the brain. Your lungs are designed to take in clean air. Smoke damages the tiny air sacs that help you breathe. Over time, these air sacs lose their strength and elasticity. This is why smokers often experience shortness of breath, persistent cough, chest tightness. Even young smokers can have lungs that function like those of much older people. Once lung tissue is damaged, it is very difficult to repair. Smoking thickens your blood. It damages blood vessels and makes them narrow. This forces your heart to work harder. Over time, this increases the risk of heart attack, stroke, high blood pressure. Many heart problems linked to smoking happen suddenly, without warning. Smoking does not just shorten life. It reduces the quality of the years you live. Smoking changes how your brain works. Nicotine quickly trains the brain to depend on it for calm, focus, and relief. Over time, your brain reduces its own natural dopamine production. This means you feel stressed without cigarettes. You feel restless when you don't smoke. You confuse addiction with needing it to function. Smoking doesn't solve stress. It creates a cycle of stress. Nicotine addiction is not about weakness. Nicotine reaches the brain in seconds. It creates a fast reward loop. The brain learns, smoke, feel relief, want more. This loop becomes stronger every day, making quitting feel difficult, even for people who truly want to stop. Many smokers believe smoking helps anxiety or sadness. In reality, smoking increases anxiety, irritability, mood swings. When nicotine levels drop, withdrawal symptoms appear, causing tension and low mood. Smoking doesn't calm the mind. It keeps the mind unstable. Smoking damages your mouth before it damages your lungs. It causes yellow or brown teeth, bad breath, gum disease, tooth loss. Smoking reduces blood flow to the gums, making healing slower and infections more common. A healthy smile becomes harder to maintain. Smoking ages the skin faster than sunlight. It reduces oxygen and nutrients to skin cells. This leads to wrinkles, dull skin, dark lips, early aging. Many smokers look older than their real age, even in their 20s and 30s. Smoking affects digestion more than people realize. It increases acid production in the stomach. It weakens the protective lining of the gut. This can cause acid reflux, stomach pain, poor appetite. The body struggles to absorb nutrients properly. Smoking weakens your immune system. Your body becomes slower at fighting infections. Smokers often get sick more often, take longer to recover, have worse outcomes from illness. Smoking quietly lowers your body's defense system. Many smokers feel tired all the time. Smoking reduces oxygen delivery to muscles and organs. Your body works harder to do simple tasks. This causes low energy, poor stamina, faster exhaustion. The boost from smoking is an illusion. Smoking affects hormones in both men and women. In men, reduced blood flow, lower performance, fertility issues. In women, hormonal imbalance, menstrual problems, higher pregnancy risks. Smoking interferes with the body's natural balance. Smoking doesn't only harm the smoker. People around you inhale the same toxic chemicals. Secondhand smoke increases the risk of lung disease, heart disease, asthma in children. Even short exposure can cause harm, especially to kids and pregnant women. There is no safe level of smoking. Light cigarettes, occasional smoking, social smoking, all still damage the body. The body doesn't measure cigarettes. It reacts to toxins. The body begins healing quickly. Within 24 hours, carbon monoxide levels drop. Oxygen levels improve. Within 72 hours, breathing becomes easier. Taste and smell improve. Withdrawal feels uncomfortable, but healing has already started. After a few weeks, circulation improves. Lung function increases. After months, cough reduces. Energy returns. Risk of heart disease drops. The body remembers how to heal when smoking stops. Quitting smoking is not losing something. It is gaining better breathing, better sleep, better focus, more years of life. Freedom feels uncomfortable at first, but powerful later. Smoking does not define you. The habit can be broken. The body can recover. The mind can relearn balance. Every cigarette not smoked is a step forward. Your future health begins with one decision.